Welcome to Mental Health Matters. My name is Barbara Meyers, and tonight's topic is Alzheimer's, which is a very important topic when concerned with the mental health of senior citizens. We're very pleased and honored to have two guests with us tonight to explore this topic. I'd like to introduce Bill Fisher, who is the Chief Executive Officer of the Alzheimer's Association of Northern California and Northern Nevada.
Good to be with you, Barbara.
Thank you. And I'd like to introduce Rich Castillo, who was a caregiver to his mother who had Alzheimer's. And Rich now leads Alzheimer's support groups in Burlingame and San Mateo. So thank you very much for being here. Welcome. I understand that your mother died of Alzheimer's and that you were her caretaker. Can you tell us some of the circumstances of your mother's illness?
My mother took care of my father, who was ill, and when he passed away, she seemed to lose touch with reality. We, as a family, just felt that it was the normal thing that one could expect after a couple had been married for 50 years and suddenly she was bereft of her mate. But I'm afraid we didn't really recognize what it was. Then we lost our home in the earthquake, and I had to move in with her, thinking that I would just be there long enough to find other arrangements. And that's when we discovered behavior that we didn't have a name for at the time. I had never heard of Alzheimer's, but things got so bad in terms of our family and how we dealt with one another that we finally, at the hospital, decided to have some kind of an analysis done. And that's when we discovered that there was something wrong and that something had a name.
Bill, can you tell us about Alzheimer's a little bit? What is it? What are some of the symptoms?
Yeah. Well, Alzheimer's is a progressive degenerative neurological disease. It's a disease of the brain that causes problems with short-term memory and problems with processing information, with thinking, and problems with behavior. And when those things occur in someone who doesn't have a history of problems, and this is a change from the way they used to behave, the doctor will often say dementia. If a person's 65 or older, the doctor may say senile dementia. My grandmother had this problem, and this was 30 years ago. When my grandmother was ill, we just said grandma was senile, but medically speaking, to be senile just means to be 65 or older. It doesn't really tell us anything about the person's cognitive function. Alzheimer's is not normal aging. It's progressive and degenerative. It gets worse over time. It can run from the beginning of symptoms to death anywhere from 2 to 25 years. The average from onset of symptoms to death is about 8 years. It's very much an age-related condition. There are about 5 million Americans with Alzheimer's disease today. And we estimate about 13% of the population over 65 and about 42% of the population over 85. So you can see it's very much an age-related curve. There are somewhere between 200 and 400,000 Americans under 60 who have Alzheimer's. We refer to those folks as early onset or young onset Alzheimer's. We will see sometimes people in their late 30s, 40s, 50s who develop Alzheimer's, but that's unusual. Generally speaking, it's a disease that accompanies aging. And that's part, by the way, of why we see so much more of it than we used to. 109 years ago, the average American lived to be 47. We didn't live in large numbers into this at-risk population. We say, according to the National Institute of Aging, there are currently 5 million Americans with Alzheimer's, and there will be 15 million Americans with Alzheimer's by the middle of this century, a tripling of the number. And the fundamental reason is what we just discussed. That is, many more of us, the baby boomers in particular, I am one, will live in large numbers into the at-risk population. So in an odd sense, I say sometimes Alzheimer's is the good news. We're living longer, healthier lives, and long enough to see lots of Alzheimer's disease.
Okay. What kind of stages does Alzheimer's go through as it progresses?
Yeah, I think the most helpful thing, I think, for viewers is to think of Alzheimer's, again, as a progressive degenerative disease. And so you're going to get worse over time. In the early going, people with Alzheimer's are very functional. So, for example, right now we have 12 early stage patient support groups. These are people who are lucid and insightful. They know they have the condition. Some of them are still working, many of them still driving, picking up their dry cleaning. They're doing okay with activities of daily living. The disease will progress, and early on, the higher order functions get compromised. Your decision-making ability, things like work, for example, is a very complex thing that humans do. There are lots of pieces, and you show up at work tomorrow, and you don't have to have people remind you, what emails you had to return, or conversations you were in the middle of, or projects that are halfway finished. You pick up the pieces and you move on with your work. People with Alzheimer's will start to have problems with those kinds of things. As the disease progresses, they'll start to have problems with very basic activities of daily living. I think sometimes it helps to think about Alzheimer's in terms of your ability to think and act sequentially, to do things in the right order. When you woke up this morning, before you got out of bed, you knew whether you were retired, you knew whether you were going to school today, you had to be at church today, at work. In the big picture of your life, you're able to keep track of it. And then you got out of bed and you put your socks on before your shoes, because you do the little things in the right sequence. If you get those things mixed up, if you wake up at 2 in the morning and you forget that you retired 6 years ago and you think you have to go to work, that's a problem. If you get up and you put on 3 pairs of pants and no top, that's a problem. So people with Alzheimer's start to have, again, early on problems with the big picture issues, planning, higher order decision making, and then as time progresses, very basic things like feeding yourself, dressing yourself, toileting yourself, things that you and I take for granted, but absolutely require short-term memory.
How is it diagnosed?
Talk to your physician about it. There's no magic to this, honestly. I mean, a good geriatric physician can do it, and unfortunately there are fewer and fewer geriatric docs all the time. Neurologists certainly might be involved in it, but they don't have to be. The key thing, quite honestly, is to find a physician who cares about it, who will listen, who will take it seriously. You go to any of the support groups that Rich leads, or many others, the caregiver support groups, listen in on our helpline, and ask families about their experience with diagnosis and physicians. And 7 times out of 10, you're going to hear that the doctor wasn't very helpful early on. We had to press. We had to ask a lot of questions. We had to insist that they take it seriously. It's hard to find physicians who care about this. I don't want to paint with too broad a brush. There certainly are lots of them out there, and it's a difficult issue.
For people to know that they should look for somebody like that.
Yeah, and that they're going to have to be a little bit persistent with the physician to get their questions answered. What's going on with Mom? What's going on with Dad? What's going on with my spouse? What's going on with me? It's not just normal aging.
Okay. How does Alzheimer's differ from dementia?
Yeah, great question. I get that all the time. So dementia is the syndrome. It's a broad stroke description of problems with short-term memory loss, problems with your ability to process information. And if you're 65 or older, they'll say senile dementia. A 58-year-old with identical symptoms, pre-senile dementia. Now, the senile is just talking about the age of the person. Dementia is not normal aging. It's worth just noting very quickly that all of us, as we age, will slow down a little bit cognitively. That's pretty typical. So you go to the grocery store for 10 items and you come home with 7 of them. And oh shoot, I was going to get milk, and you forgot about it. But if you get lost coming home from the grocery store, a trip that's familiar to you, that's not normal aging. And now we have a memory deficit that gets in the way of living independently. That's when we start to worry about things like dementia. Alzheimer's is the most common cause of dementia in people over the age of 65. Counts for about 65% of cases of dementia in seniors. Just like all roses are flowers, but not all flowers are roses, all Alzheimer's is dementia, but not all dementia is Alzheimer's. There are some other progressive degenerative dementias that seniors get, things like frontal temporal lobe dementia, Lewy body dementia, vascular dementia, but Alzheimer's is far and away the most common cause. And oftentimes when I meet somebody and they say, well, you know, there at the end, Mom didn't know the names of the kids anymore, but I don't think she had Alzheimer's. She just had dementia. Well, yeah, she had dementia, and probably she had Alzheimer's. Alzheimer's is that dementia doesn't actually tell us what caused it. It's just describing how the person behaved.
Rich, what kind of symptoms did your mother show?
The first symptoms that we noticed had to do with food and cooking. My mother was a great cook, and suddenly she just didn't know how to do things any longer, and she would ask me to help her. I do remember her asking me how to make spaghetti, and my mother made a killer spaghetti sauce. I don't know how she made it, but when I started to tell her what I thought she did, she said, no, the other. And then it became clear what she wanted to know how to do was to boil the spaghetti. So that's how we first noticed it. But again, not realizing that it was a disease. At first we thought, and I think that viewers should know about this, the behavior is such because the patient is also coping. The patient knows what's going on, may not have a name for the disease. And my mother would cover for herself. So she would say things like, oh, I forgot something, just as a way of not having to admit that she didn't remember how to do it. So that's how we saw it. It was just doing little things around the house that she simply couldn't do any longer. And then it got worse. She started insisting from any visual cue that, for example, she would see something on the television and she'd say, I was just there yesterday. And it might be a picture of the Taj Mahal. So, you know, and then we, of course, not knowing what was wrong with her, we would argue with her, Mom, that's in India. You've never been to India. So.
I know a lot of people who are older have depression. How do you tell the difference between depression and Alzheimer's?
Yeah. So depression, as you say, is not uncommon in seniors, and Alzheimer's is also a statistically common disease. But they're quite different. Depression can cause some of the symptoms that look like early parts of Alzheimer's. So a person who's depressed may be apathetic, they may be listless, they may be less communicative than they were previously. Depression, of course, is treatable and manageable. Alzheimer's is progressive and degenerative, and you're not going to get better. Depression can accompany Alzheimer's. So depression can be one of the side effects of Alzheimer's. So it's important for the doctor to take these things seriously. I know at some academic medical centers that specialize in Alzheimer's, when in clinical settings, when they see someone and diagnose them, they will routinely treat the person for depression. Depression can be a sort of an excess disability in a way, because I've got a real disease that's causing me confusion and making it hard for me to remember and form new memories and process information, and I'm depressed. So maybe if we can get rid of the depression, I'll do a little better, as Rich would say, coping early on with the things that I can't treat medically.
Are there benefits to early diagnosis?
Yeah, we certainly think so. The two principal things I would say to people are, first of all, there are drugs approved by the Food and Drug Administration for the symptomatic treatment of Alzheimer's disease. They don't cure it, they don't send people back to where they used to be. But most of the data, at least with the 3 cholinesterase inhibitors, there are 4 drugs approved by the FDA, and 3 of them are what are known as cholinesterase inhibitors, and all of the data about them indicates that you get the biggest bang out of them in the early part of the disease. So if you wait a year and a half, 2 years to get assessed and diagnosed, you may have missed that window of most benefit from those medications. That's one thing. The second thing is, for all of us, wouldn't we like to be involved in the planning of our own future?
Right.
And if we identify this early on, we can make decisions, durable power of attorney for health care. What do I want done if I can't feed myself? How do I want my family to manage that? I take the burden away from them to have to make those decisions when I can no longer decide for myself by deciding when I'm competent to make those decisions. There are all kinds of things that I can decide and participate in the planning of my future if we get to this early enough.
Now, I know you said that it's a progressive degenerative disease. What is it that causes it?
Yeah, we don't know the clear answer to that. Again, the principal risk factors for Alzheimer's are, first and foremost, age and genetics. A quick note about genetics, I'm not saying that it's a purely familial or hereditary disease, so that if you had a first-degree relative with Alzheimer's, you have an increased risk of developing Alzheimer's, but it doesn't mean you will get it. So those are the two principal risk factors. We know that there's a correlation between head trauma and Alzheimer's. But that doesn't mean that everyone who suffered head trauma will get Alzheimer's by any stretch, but we know you have an increased risk of developing it. We're starting also to look at some lifestyle issues. Over the last 7-8 years, there's been a lot of data suggesting that what's good for your heart is also healthy for your brain. Relationship between diabetes and Alzheimer's, between cardiovascular problems, high blood pressure, hypertension, etc., and Alzheimer's. Now, I want to just be real clear. I'm not saying that that you will get Alzheimer's if you have those problems, but there's a lot of data suggesting a relationship. We'd love to know the answer to those things, of course, because what I'd like to be able to tell everybody is to eat your green leafy vegetables and your blueberries and you know, play bridge and do your crossword puzzles and stay socially connected and interactive and get out there and exercise and keep your blood pressure down and your weight down and all those things that are good for us anyway. But I'd like to be able to say that doing those things will reduce your risk of developing Alzheimer's. We're not quite there yet, but the data is pointing us in that direction.
That's encouraging.
Yes, it is.
Rich, I'd like to ask you some more about your story. What did you go through when you first heard her diagnosis?
If I could say, the first mention of the word was by a social worker through the hospital's family and mental services. While my mother was having some physical work done with her doctor down below, I went up and talked to a counselor because our family was falling apart. We were going through hell. And I just talked to a social worker who listened. She started to take notes, but then she gave up and she just listened to me and let me vent. And when I was done, she closed her binder and said, I think rather unprofessionally, it's a textbook case of Alzheimer's. Put her in a home. And that's the first time that I actually heard the word Alzheimer's. So it was a really hard time, and I can't honestly say now, even looking back on it, that I reacted because I didn't even know what Alzheimer's was. However, to say something good about that same social worker, she gave me the name of the Alzheimer's Association and a number to call so that I could get some help.
How did you assist with her care at first and then later on?
In the beginning, my mother was fairly high functioning. The problems that she had came more from, I hate to say this, from our trying to insist that she knew how to do things and could remember them. We would fight with her when she would present herself as not knowing how to do something. And so maybe if the disease has stages, as you spoke about, I would say the caregiver has stages too. And that's important for your audience to know, that things got much better for us when, after going to some support groups, we learned about how to, the special needs that people have and how to care for people and how to not fight this disease, but to go with the disease, to go with the flow. Because the majority of the problems that we had came from trying to make her get well again.
The single hardest thing for caregivers, for family caregivers to get to is that point. Letting go of that desire to reason with the person, to explain reality, to explain where they are, to explain what they shouldn't do. And it's so hard for people to let go of that notion that if mom thinks that I'm Uncle Joe instead of her son, then at some point maybe we actually get along better that way. And her reality is going to be okay. It's going to need to be okay. And we can reduce her anxiety and her level of frustration and our blood pressure as a caregiver by accepting that. But as Rich says, it's really hard because it's not where you've been, right? You're dealing with this from the relationship and the experience that you had up to this point, and it wasn't like that.
It is particularly hard, I think, for someone like myself, which is to say, when it is the child and the parent. Spouses have a different dynamic. But when you are confronted with having to set all the rules for the person who set the rules for you, it's a total role reversal, and it's a little hard to assume.
Well, yeah, I can see how that would be psychologically even difficult
it is.
that way. I know this was some time ago that your mother died. Are there things available now that might have helped you back then?
Well, certainly when my mother was diagnosed, there was just no medication at all. Well, the medication was actually for the behavioral problems. And I guess Cognex came out at that time, and it had a lot of side effects. My mother was already too far gone by the time that it came out. But we were just fighting all the time. You know, we didn't have resources except for the things that would help us as caregivers.
Were there any safety issues?
In my mother's case, my mother was not a wanderer, which some people have. But what my mother did do is manage when I was not around. She managed to burn and melt pots on the electric stove. She would put things on the stove and turn it on high and walk away, and then the pot would melt, and you know the burners would go. She took some of those hot pots off the stove and dropped them on the floor so they melted the linoleum. She started 3 fires because for her anything that had this shape was an ashtray. So if it happened to be a wastebasket with paper in it, we had 3 fires, and you know, not terrible. We were there and we caught them, but it's a little scary. And she also had the habit of wanting to clean things, do laundry. She would take off her little mini socks, and then she would go outside naked and put them in the washing machine and turn on the washing machine with a cup of Tide and just 2 little mini socks in it. And we would discover this because she would stand out there and wait for it to finish.
Oh dear. Did she stay at home with you until she died, or was she in...
She was at home with us till the end, shy a couple of months because a hip broke. She didn't fall. The doctor insists that while she was walking, her hip broke, and then she fell. And then she went in and had a hip operation, pins, but there was osteoporosis, and that did not take. And so they redid an operation and put the half hip replacement. But then she got pneumonia, and she just really never came home after that.
Sorry to hear that. Well, what gave you hope in all this process?
It was a pretty hopeless time in our lives. But I wish I could answer this with a specific day or date or event. But I can only tell you that the tremendous support we got from the Alzheimer's Association turned us into caregivers who at some point had an epiphany. We realized that we had been given a sweet little girl to take care of. When we stopped trying to have my mother
Yeah.
be the queen of the house and just accept that we had this wonderful, sweet, you met my mother. You know, she was sweet. She became our little girl. And certainly we got a lesson in love that is just irreplaceable. So love is hope.
Did her having Alzheimer's that affect your grieving for her in any way after she died, or do you know? I don't know. Maybe it's hard to compare those kind of experiences.
Well, I don't know if I can say this on air just because it sounds so negative, but I'm afraid for those of us who care 24/7 for a loved one with this disease, you actually do your grieving before the physical body dies. You've lost the person. Everything that you know and associate with that person is gone. So we had in our home a person whom we loved and who loved us. That was obvious. So my grieving, if this makes any sense, was kind of joyful. So I'm sort of convinced that God gave her back her memory when she died.
Wow. What keeps you on an even keel now?
I don't know that I'm so even, but, but among other things, I do 2 support groups, and being able to give my experiences to help other people, and also I do public policy work. That's a hangover from when I was on the board. I was never a political person before, but this thing really lit my fire, and that helps keep me grounded.
Well, thank you very much. There are some resources that I'd like to leave you with. We've already talked about the Alzheimer's Association. The web address for the Alzheimer's Association is www.alz.org. And Rich was saying that it was this organization that really gave him the tools to understand what was going on with the illness. Alzheimer's Association is the first and largest organization dedicated to finding prevention methods, treatments, and maybe even an eventual cure for Alzheimer's. It offers a number of support groups all over the country, actually, and Rich has a couple of them in the Bay Area that he works with. It works in understanding Alzheimer's. There's a 24-hour helpline, 1-800-272-3900, that people can call at any time. And I couldn't recommend more highly that you would look at this website and find out what resources are available, because this is an excellent organization. I'd like to thank Rich and Bill for being with us today. And I'll end with these closing words by the Reverend Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there is another truth. You are not alone. Thank you for watching, and we'll see you next time.